recording. Excuse me, let's bring up the slides. My name is Julia Isaacs. I am one of the co-leads of the monthly meeting team, which helps put on these meetings. Suddenly have a frog in my throat. I want to acknowledge Christina Cook, who is our Zoom host, who is helping to advance the slides, and Marion Friedel and Susan Nossel, two other members of the monthly meeting team, will be helping behind the scenes. We'd like to start off by sharing a few slides from our action on Saturday. This is from, well, it's mostly the Divest and Defund team with lots of help with the Art Collective, who made this amazing sign. We did not do actions on the square in the time leading up to election season because so many people in 350 Wisconsin were working with the election as one of the ways to address climate change. But we decided to have an event on Saturday, which was the last day of the farmers market. And as you can tell from our clothes, was quite, as you may remember, was quite cold. I guess the sign speaks for itself. Chase Bank is the #1 funder of climate death. This view is from inside Chase Bank, the lobby, looking out. We walked around, partly because it draws attention and partly to stay warm. But here we were facing the employees and facing the bank. And I think I'll show one more slide of the This shows us in front of Chase Bank. And you can see that this is our big sign, again, the Art Collective, and I want to shout out to Richard Jones. We also you can see some of those smaller signs. I'm holding up one that says, "Our world is on fire. Blame Wall Street, stop funding fossil fuels." There's another one that says, "Blame Wall Street." If you want one of those smaller signs, perhaps if you live where people walk by as a, what's the word for it? Yard sign, you can contact Russ Bennett because he has some of those. That was just a preview as we're waiting for people to arrive. Let's go on to the rest of to start more generally. So I invite you to take a couple of deep breaths with your feet planted firmly on the ground as we look at this photo of cranes with their feet on the ground. This is from the International Crane Foundation. I have almost been this close to cranes to get pictures with an iPhone, but this was the International Crane Foundation. So 2 deep breaths. Breathe in and out and in and out. We also use this time of reflection to acknowledge the debt we owe to the indigenous peoples who steward these lands until they were forced off them. I live near Madison on the ancestral home of the Ho-Chungra, or people of the sacred voice, who today are known as members of the Ho-Chunk Nation. So in preparing for tonight, I tried to look up the Ho-Chunk word for crane on the internet to share it with you. Instead, what I learned is that only a few dozen people speak Ho-Chunk today. With so many deaths from the diseases and then being forced off the land in Wisconsin in 1832, much of the Ho-Chunk language and culture has died out. Yet we know that they lived on these lands and that they listened to the sounds of the cranes calling as they fly. And some of them still live here today. So I want to acknowledge their presence on this land, past and present. When I Googled cranes and Ho-Chunk, I also learned that the gaming casino in Baraboo
Did we lose Julia? Briefly.
Can you not hear me?
Your video cut out for a minute.
Okay, but you can hear me? Next slide. So we've just had our opening and land acknowledgement, and I want to welcome everyone again. I know we have at least 2 newcomers, Amber and Ron, so a special welcome to you. And I know we have other newcomers, and we will have time at near the end of our meeting to have a more of a welcome for newcomers, but welcome, an early welcome now. We're about to hear from 350 Wisconsin Action, some thank yous, and then we'll turn to our main event, talking about climate change and health with Dr. Andrew Lewandowski. And then we have some interesting team updates and announcements of upcoming events. At the very end of the evening, we will have time to talk to newcomers, and then some of us will go into optional breakouts to talk more with our speaker or to learn more about something called peer-to-peer fundraising. So with that overview, I'm going to turn it over to Gail and our next slide.
Good evening. And I wanted to start by saying thank you to everyone who participated in 350 Wisconsin's Action's first campaign working on the midterm election. And it was everyone who participated that made it a big success. The picture you see here is a group that was canvassing in Stevens Point. And what they're holding are these beautiful bookmarks that we handed out to the people where we canvassed at their homes, and they were made by with the creativity and hard work of people from our art collective and our communications team. So just one example of the kind of work that went into this campaign. Next slide, please. So what did we accomplish? These are preliminary numbers. They may change a little. We're pulling all the data together, but there were 104 individual volunteers and donors to the campaign, which is really phenomenal. So to everyone who's listening, if you did anything, writing a postcard, making phone calls, making a donation, anything you did, we sincerely thank you. And since some people did more than one thing, we had 158 separate volunteer activities. So what were the things we did? Collectively, we wrote 1,800 personalized postcards to people in Congressional District 3. We called 1,933 voters. We canvassed and knocked on 342 doors. We participated in 3 student events, one at Madison College and 2 on the UW-Madison campus. We wrote letters to the editor. We had a really nice website, social media. We started social media accounts on Twitter, Instagram, and Facebook, and some of us appeared in radio and podcast appearances. So it was a big effort, and it took everyone, and it worked. The other thing we achieved, we're in this for the long run, and we made lots of progress getting support from donors, which is of course very important, and also just developing our organization for going forward. Because the long-term goal, of course, is to have a strong organization that advocates for elected officials and policies that will bring about what we need for the climate. Next slide, please. So what comes next? We'll be gearing up again in next spring for the Wisconsin Supreme Court race, which will be very important, particularly with respect to gerrymandering, and hopefully being able to make a change in that. Of course, in 2024, there'll be a presidential election, a Senate election. We'll also be, through 350 Wisconsin Action, increasing our issue advocacy and taking that to the next level in terms of advocating for strong state and local policies. So that's just in a nutshell. Again, thank you. And if you want to learn more, you could go to the 350 Wisconsin Action website, which is there, 350wisconsinaction.org. And you could learn more, you could volunteer, and you could donate at that site. So thanks again.
Well, thank you, Gail, for stepping in and taking on an additional job, as some people know, during this time-sensitive time before the elections. So we occasionally do this, maybe twice a year, where we ask you to get in small groups. And our question today is, we always, what's your name and how are you involved with 350 Wisconsin? Maybe it's your first time, maybe you're on 4 different teams, just let us know. And what action did you take to elect climate champions in place of climate deniers? We always want to know, did we help empower you to take action for the climate? And then we'll come back here. So I think what's going to happen is that Susan Nossel's going to put that in the chat. Maybe she already has. And then Christina's going to send us to breakout rooms. And you just click yes when you get put to a breakout room. Say join, and we'll see you back here.
Marion, yeah, thank you.
Well, we all hope that was fun, that you met somebody maybe you knew and met somebody you didn't know and got to hear some inspiring stories about people working on this important election. We're going to now turn to our featured speaker for this evening. I'm pleased to introduce Dr. Andrew Lewandowski, who is a pediatrician with Group Health Cooperative in Madison. He talks with the public and policymakers and his patients about climate change and health. He also leads a team of pediatricians who are working to create climate change communication modules through the American Board of Pediatrics. He is an advocate for climate justice solutions that address the disproportionate burden of disease climate change inflicts on marginalized communities. As an advocate, Dr. Lewandowski has served as a resource to the Wisconsin Governor's Task Force on Climate Change, and he's filled a lot of leadership positions in other places. And we're just really excited that he can join us tonight. I'm going to turn it over to you, Andrew.
Hi, everybody. Thanks for having me. This is really informal. If people want to interrupt to talk, I think that's great. But there is no way to cover everything I would love to cover within 20 minutes. So I'll probably truncate some stuff. And then my understanding is we'll have a little bit of time for Q&A at the end of this. And then I'll also be sticking around for the breakout session at the end that it sounds like you guys are going to be having a little after 8 o'clock. So I'm just going to go ahead and share my screen, and we'll go through some slides just so that we have a shared mental model. And then we will go from there. So you should be able to see my screen, and I'm going to jump into a slideshow view. So we're seeing this okay?
Yes.
All right. So this is what I am going to be talking about tonight. So communicating about climate change and health. The land that I'm presenting from was previously occupied by the Kickapoo, Ho-Chunk, Peoria, Sauk, Sioux, and Miamia tribes. I am a pediatrician and a climate medicine physician, and I, for better or worse, do not get paid to do what I do. But if anyone wants to pay us, there are a lot of us who would love to get paid for this work. Anyway, so here's really what I would like to cover today. We're going to briefly describe the effects of climate change on health, discuss the role of the healthcare provider in climate change solutions, and then examine one approach to counseling patients about climate change. And so when we talk about climate and health, I really love this infographic. It comes from the CDC. And essentially you have kind of this quadrant that we routinely refer to in the climate space that we see associated with climate change or global warming. So you have rising temperatures, more extreme weather, rising sea levels, and increasing carbon dioxide, CO2, or I mean, in general, you can also think just greenhouse gas levels going up. And there's kind of a spinoff from this that then goes to how our environment changes. And you can see the environmental changes that we'll see. So extreme heat all the way around. But then from these environmental factors, we are creatures that live in this environment. And so then there are going to be negative health effects that come from the way that our environment affects us. So for example, I think the stereotypical things that people hear about is, well, there's air pollution, and so that can exacerbate asthma. Or there's extreme heat, so you're more likely to see cases of heat exhaustion or heat stroke. And that certainly is true. But, when you look at it from a health standpoint, it's really complicated. And there are a lot of ways that things really kind of web together. And so, for example, with extreme heat, am I more concerned about my teenage patients who have high metabolism, who are doing, 2-a-day practices in July as they're trying out for the soccer team? Yeah, I definitely am. But I'm also concerned about the type 1 diabetic who needs insulin in order for them to survive, because people don't always realize this, but insulin, which is a protein that our body makes to control our blood sugar, the type 1 diabetics who can't create that insulin, they need to provide it to their bodies. And so if you use that, if you want to store that insulin, it has to be kept at 86 degrees or less, or it's not going to be as effective. There are plenty of days that temperatures in Wisconsin get above 86 degrees. And with climate change, we know that that's increasing. And so what does that mean for the stability of that medication that is crucial for this person to live? The number of times that they end up having exacerbations or issues related to their type 1 diabetes. Or fluid balance. We know that fluid balance is really important as far as what you drink versus what you pee out. A lot of other ways for us to balance fluid in our bodies. Kidney conditions are susceptible to fluid balance issues. Cardiovascular conditions are susceptible to fluid imbalances. And on top of these extreme heat causing issues with medication or chronic medical risk, you also then have things that are indirect effects from stuff like severe weather. There's indirect effects really from all these things. So I guess really what I want people to realize is that, this slide where we go over quote unquote the waves made by climate change, that while there are direct effects, for example, the ground level ozone more easily forming in warmer climates that can exacerbate asthma, while we do see that, we live within a structure that needs to provide for our health. And I can't think of better examples than, in 2018, when we had that severe flooding and it knocked out a health clinic on the west side of Madison, or when Hurricane Maria swept through Puerto Rico. And people may not realize this, but Puerto Rico is probably the major supplier of normal saline bags, or like the actual bags that hold the IV fluids. And so if you don't have those bags, you can't necessarily as easily provide for the people who you're taking care of. So I just want people to realize that it's multifactorial, and it's not necessarily just the direct effects that we see, the person who drowns in a flood, but maybe the societal structure and infrastructure that's required for people's health to be served. And we can get into these things later if people are interested in it, but I want to get more into the climate and health messaging piece. So public perceptions in Wisconsin, these are the Yale climate opinion maps from 2021, and these probably aren't too surprising to people, but 69% of Wisconsinites think that global warming is happening. 55% felt like it was mostly caused by human activities. 62% were worried. And now we're talking about harms down here. 70% think that this is a problem for the future. 62% feel that global warming will harm people in the US. 42% feel that global warming will harm them personally. 56% think that it's currently harming people in the United States. But then kind of the equalizer down here, which I always go to, it's shocking that you have things that sometimes we can see political divides like this point here and this point here, but yet the vast majority of people support funding research into, some of the things that are actually going to mitigate climate change's effects. Now, the majority of America, this comes from an Eco America climate perspective survey in 2021. And I think that this does a really good job of showing where health lies as a potential game changer for climate change messaging. And the survey question asked, would you support climate solutions if they benefited any of the following? Please select all that apply. So there was no this or that, but it's select everything that applies to you. And you can see here that people care more about their health as it relates to climate change than they do about jobs in the economy. And this is 2021. This is not like a pre-pandemic number. And so, you know, numbers like this really speak volumes to me. More Americans trust health professionals. Sorry, I'm now for climate change information. And you can see, I mean, in this day and age where we're trying to figure out who are those trusted messengers, this data would suggest even for climate change, which is not typically thought to be the wheelhouse, I think, by most people when it comes to, for physicians for this to be the wheelhouse, you can see here that 68% of people say that they would trust what their doctor has to say about that. And so, you know, is it my job to change my patient's perception of climate change? That's maybe the next thing. And I would say that when it comes to public perception, it certainly isn't something that doctors have had to stray away from in the past. I mean, once upon a time, we didn't counsel people about smoking cigarettes, much less secondhand smoke or thirdhand smoke exposure. And, you know, that's something that you can't make it to a doctor's office without it being on a screening questionnaire now. Institutional support is also readily available in the healthcare community. And so this U.S. call to action on climate, health and equity, this policy action agenda, this is the endorsement statement. And it says the undersigned organizations and individuals call on government, business, and civil society leaders, elected officials, and candidates for office to recognize climate change as a health emergency and to work across government agencies and with communities and businesses to prioritize action on this climate, health, and equity policy action agenda, which spelled out at least 10 different steps for equitable climate change mitigation and adaptation. And this was signed by over 160 health organizations. And I'm just going to pull up here are just some of, this is just a screenshot and I highlighted some of them. These are big name groups like the American Medical Association. This is essentially like the medical association in the United States. The American Academy of Pediatrics, this is where I go to get my pediatric guidelines for treating patients. These are mainstream institutions. And so there is institutional support for climate change solutions from pretty much every major medical institution in the United States. The American Medical Association also has this Journal of Ethics, and I pulled this out of one of their volumes. They have an entire volume just dedicated to climate change, and they say the health consequences of climate change are visible, often measurable, pose serious threats everywhere, and offer opportunities to significantly improve health everywhere. Embracing sustainability at the individual or organizational level thus helps to fulfill professional obligation to protect health. So there's this ethical obligation. The American Academy of Pediatrics is probably one of the biggest leaders when it comes to climate change. They were the first to publish a policy statement in 2008. This is actually their updated policy statement in November 2015. And they have a recommendation section where they spell out 6 different recommendations for pediatricians in the healthcare sector. And what I want to make sure that we focus on today is actually point number 3, use existing anticipatory guidance as a framework for discussing climate change with families. So anticipatory guidance, this is essentially, what is your doctor going to counsel you about? And whether it has to do with diet, nutrition, healthy sleep, all sorts of things, screen use. There are lots of things that we talk to people about in pediatrics. And this recommendation is saying, yeah, we should be talking about climate change in clinic with our families. But you know what, when I was talking to my colleagues, I mean, I don't know about any of you, but when was the last time any of your doctors talked to you or because we see similar guidelines for, internists and family practice. So this isn't something that just has to be confined to the childhood area. And I recognize that people weren't really talking about it. So what did I do? Well, I decided to follow the recommendations. And so this is just a made up social history. Your social history is essentially when you find out more about the family, because again, environment affects health. Who lives at home? What do their parents do? Is there social agency enrollment? Is there smoking? Are there pets? What kind of car seats your kid in? Do they know how to swim? Do you use sunscreen, bug spray? And so I talk about climate change in my clinic. And so my spiel or my talk that I give, and you adapt it over time, but I ended up publishing a study about my results. So this is kind of related to that study. I said essentially, so in 2019, the American Academy of Pediatrics declared climate change a health emergency. There are about 9 different ways that climate change is hurting people, and it disproportionately hurts children, which is one of the reasons that the American Academy of Pediatrics encourages pediatricians to talk about climate change in their clinic. I certainly don't expect you or your family to fix climate change on your own, but my job is to let you know what's affecting your children's health and to let you know that when you save energy or support clean energy initiatives, that you're also helping with the health of your children. Do you have any questions about that? And so that reads out to be about 45 seconds. And after a while, I started wondering, is the 45 seconds worth it? And so I did a 7-question anonymous survey of 234 patient families. 138 responded. In the survey world, 58.5% is an excellent response rate, generally thought to be reflective of the population you're trying to survey. And these were what I wanted to know. Did they learn more about climate change related health harms as a result of the counseling? Were they more likely to save energy or support clean energy initiatives as a result of the counseling? Did the person's self-identified political identity play a role? And then what are their reactions to counseling? And this was a free response section. I think any of us who have ever been evaluated know that, the numbers don't always mean stuff when they're doing their like 1 to 5 or 1 to 10 response for you. But when they get to the free response, man, if people are not happy with what you have to say, they will be more than happy to lean into you in an anonymous setting. And so I really wanted to know, like, what did people really think? And obviously, as a doctor, as you're approaching this potentially, politically divisive topic, I'm wondering, like, geez, am I pushing away families? Like, what's going on? How are people receiving this? And so I did end up publishing this in the Journal of Climate Change and Health towards the end of October with some of my colleagues. And here's what we found. So prior awareness. So this was, did you know about climate and health before I gave you a 45-second talk? And I will say this was actually pretty shocking to me that 82% of my patients who responded or families who responded said that they did. 90%, you can see that this did kind of follow along party lines, and these ends are not gigantic. So please keep in mind that some of them may not be completely statistically related, but you can see 90%, yes, 78%, but even 57% of the conservative participants said that they already knew about climate change related health harms. Now, how many of them learned more about counseling from that 45 seconds? And across the board, you can see everyone said, wow, they learned more. That's great. Now, likelihood of changing energy use behaviors. This is where maybe a group like 350 Madison or a lot of our multidisciplinary partnerships would really want to see this, is that just from that 45 seconds, you can see likely or very unlikely all the way to very unlikely. First of all, there was no backfire effect. There was no one who became less likely to save energy, weatherize their house or other things as a result of counseling provided. And we had many people across the board, whether you're conservative or liberal, saying, oh yeah, I'll do something if it means it's going to help. Likelihood of supporting clean energy initiatives. It wasn't maybe as robust support for conservative participants, but imagine if you had if you had an argument that would get, 70% of conservatives to say that they would be likely to support clean energy initiatives. And you can see, the numbers for the liberals is probably not as surprising. Free response section. So there are 4 themes that I highlight in the papers, but I'm only going to go over 2 of the themes here. First one is counseling effectiveness. These are actual responses from these are actual free responses from the patients that I counseled and got responses from. One said, appreciate it. We've made changes since having our first child due to the information provided. Another said, we didn't previously realize how its importance stacked up against other child-related safety concerns. It's good to better understand the gravity. This is a different section, but you can see here, it was very informative, or a different theme, I should say. We already use LED lights in our house. We're getting new windows installed in the next couple months, blah, blah, blah. We have a smart thermostat so we can save on energy costs. This person says it's good to know, change things in our homes to make it healthier for our children. I bet if I asked you to identify what the theme was for this section, that most people would not be able to realize that this is actually, these are all responses from conservatives who participated in the counseling section. Or in the survey. So I just want to really dispel this belief that there's a major political divide And now granted, there's a political divide to climate change to some extent, but all of the values that go into fixing climate change or messaging so that we're on the same page, it's all there. And so communication conclusions. So climate change and health can be discussed succinctly in a healthcare setting. Health does provide a less partisan and important message for climate justice solutions. That support for climate change mitigation and adaptation is supported globally by the healthcare sector and by all the major medical associations in the United States. And that counseling about climate change and health can make a difference. And I think that this personal touch, people generally care about what their doctor has to say. And there's something to be said for that relationship that people have with their doctor. And it's kind of funny, when we see this with other topics too. For example, when people in the COVID pandemic, we had the COVID vaccines first start rolling out, and people would say, "Oh, well, what do you think about the COVID vaccine?" Well, I mean, to be honest, even with my undergrad being in like medical microbiology and immunology, there's still no way that I know more about COVID and COVID vaccines than Tony Fauci. There's no way that I know more than the CDC. But people don't care what the CDC or this random dude who's sometimes in the media is saying, even though they have all the credentials, all the bandwidth, everything to actually draw the right conclusions. No, they care about what their doctor thinks. And so this is where I think that support from the medical community, especially when there's that personal touch for people who live in your community, people who can connect with those patients, people who are quote unquote in the trenches, so to say, like actually seeing patients every day rather than like hearing what the AMA has to say. I really do think that it makes a difference, and it can affect the change based on my experiences in clinic and with counseling. So, what now? So the Lancet is an international medical journal, and they published in their Lancet Countdown, which is now a yearly journal that documents climate and health concerns. They said that the response to climate change could be the greatest global health opportunity of the 21st century. And so we just have to ask ourselves, what are we going to do with that opportunity, and how are we going to promote that messaging? And I'm sure a phrase that many of you don't necessarily need to know, but as a pediatrician, I feel obligated to kind of show, is that we can always take a page out of the Lorax, that unless someone like you cares a whole awful lot, that nothing is going to get better. It's not. And then here are my references if anyone's interested, and I would welcome any questions.
Well, thank you, Andrew. I can see why we were told we had to have you come speak. That was a wonderfully inspiring talk. Susan, Millar, I see you have a question. Do you want to unmute yourself, or do you want me to read it out in the chat?
No, I can speak it. So I'm super excited by your findings, Andrew. And the question I have is how do you communicate with other pediatricians about the power of your findings there, and possibly to general practitioners and other types of medical doctors? Thanks.
Yeah, so I mean, I communicate with pediatricians. So there are a variety of formats that you can do that. I mean, certainly there are times where I give these larger presentations to like an HMO, for example, or, Wisconsin Health Professionals for Climate Action, or the Wisconsin Environmental Health Network. Those are probably two of your two partners for 350 Wisconsin, who they hold these events that will oftentimes include climate and health. And so you might speak in those in their conferences where healthcare professionals will be able to obtain credit to attend these sessions. And so you can communicate that way. I mean, you can do one-on-one, but then also I think there's a major important component to training the next generation of physicians, and making sure that the students who, honestly, the students are medical students, PA students, nursing students, all students are so hungry for this information. And unfortunately, there isn't enough leadership in the academic ranks to provide that. But connecting with those students has been also really helpful. And I've done, talks for a medical student run climate change elective at the University of Michigan. So there are lots of ways to connect with current and future health professionals. And I did see someone put in the chat after I stopped sharing my screen, the comment about nurses, which is absolutely true. In fact, most surveys will actually say that people trust nurses more than doctors. And so by all means, all healthcare professionals should be included. I don't take offense to that. I just recognize it for what it is. But, I think making sure that people realize that climate change is a health issue. It's not, it's an environmental issue, but that it is a health issue because we live on this earth. And to make sure that people realize that if you're communicating about health and just saying, I'm genuinely concerned about your health, that it's no different than me counseling about smoke, diet, sleep, anything else. It really depoliticizes it. And once you tell pediatricians about that, and it does help to have a published article to show you that, that usually it becomes maybe a little easier for people to consider. Sorry, that was a long response, but there's kind of a lot that goes into it.
That's great. Kyla, you have a question for Andrew.
Yeah, I have many questions. So if you have like an email or something, maybe I could.
Yeah, I will drop my email in the chat for everybody.
Okay. But I guess the question I'll ask is I kind of when I think about climate change perspectives and stuff, I kind of also want to bring in demographics of like income level, or if somebody rents versus owning a house. Because I know that one person was talking about, oh, well, we have all these new upgrades in our home, but like, especially within Madison, when a large proportion of our population rents, I wonder how that would go into data. But I was just going to ask, did you take into consideration, or did you ask those questions when you're doing the surveys to the families with income rate, and then also if they rent or own their home?
So there's no way for me to factor that in pre-survey, because when someone walks through the door, I'm not going to know necessarily what their income level is. I could see if they're on state-sponsored insurance or not, or things like that. But when it came to trying to standardize for the purpose of the survey that I showed you, that was not done. Now, what I will tell you is that Julie introduced in my introduction, she said something about working on something with the American Board of Pediatrics. That is something that we have incorporated into the module that we're doing for pediatricians, that, climate justice solutions, there needs to be that justice component. And recognizing that some people are hit harder than others, and that your counseling needs to be tailored to taking into consideration things like environmental racism, to take into effect things like income disparities, and communities that have been historically economically disadvantaged. And then maybe in that situation, so I work on the east side of Madison, where I will say that I have plenty of people with brand new homes in Sun Prairie, Cottage Grove. Like, the counseling that I give is not generally going to be for the safety net, barriers to access, that kind of thing. But I will tell you that if I am seeing patients who I know maybe struggle more financially, then I may be looking more at, hey, here are some of the things that may affect your child, going back to type 1 diabetes. If a child has type 1 diabetes and needs insulin, saying, hey, I don't know if you know this, but with the warming temperatures related to climate change, I'm concerned about the safety of the storage of a child's insulin. Or maybe if they have seizures, and we know that seizures require a very specific blood level sometimes for the medications that they take, and making sure that they recognize that they're going to be at greater risk of dehydration. Do we have access to air conditioning or not? If so, are we able to pay those bills? For my asthmatics, or for patients with what we call atopic diseases, allergies, asthma, eczema, is there mold in the home? What's their environment like? A lot of places, people may have issues with severe mold, but they're worried that if they try to bring something up to the landlord, they're going to be evicted. But the water table might not be in their favor, because people around Lake Mendota who wield the power don't want the water levels to drop because they need their boating. Right? There are so many aspects that go into that, where maybe instead of saying, hey, you people who actually have these smallest carbon footprints, what are you doing to decrease your impact on climate change? Instead, maybe talk to them more about what are some things that we can do to help those populations who are going to get hurt first and worst, and make sure that they have the best access to medical care that they can, when they probably already have so many other barriers to that care.
I just wanted to say like one thing off of that. Like, I know you say you don't do pre-survey screening for that, but I'm guessing you do like social determinants of health screening. So like maybe you could incorporate that into the data. I don't know. I was just like, I've done research before, so my brain has been like, okay, like how do we do?
Yeah. So what I did, and you can certainly, maybe what I can do. So at the end of that, so my survey is in the references section of the talk. There's a lot of stuff that I didn't go into, but in that you will be able to see like the payer structure for my patient panel that I see, a racial breakdown, a self-identified racial breakdown for that structure. There are other data components if you're interested in that sort of information that you might be able to extrapolate from that. Otherwise, you can email me too.
All right. Thank you so much.
Yeah.
We have time for quick questions. Let me get 2 questions and then give you a chance to answer. Let me hear Michael's question and Jeanette's.
Okay, thanks. Yeah, I'll make these very brief. My first question is, to what extent is the implementation of a national single-payer health care system absolutely necessary in order to address a lot of these environmental concerns? And then my second question, this is a somewhat dangerous one because it's a very unpopular topic, but how crucial is some type of population control? Because I believe that control of population is the key to regulating many of the factors that you discussed in that CDC chart. Thanks.
And let's hear Jeanette's question and then let's get all the questions out. Go ahead,
Okay.
Jeanette. Just one question if you can.
Oh, if I can squeeze in 2 questions, because one of them is kind of yes or no.
I can
Okay.
try to be succinct as well. I
Okay.
promise.
Yeah, so the first easy question is, do you think it was the health message generically that was effective, or was it the health impacts on your children that made a difference? And then the second one was, after your 45-second spiel, what kind of follow-up questions do you get?
All right. I wrote those down just to make sure I get to them all. National single-payer healthcare, is it necessary for environmental concerns, like to address environmental concerns from a healthcare perspective? I don't know. It honestly would probably be faster just to try to leverage the current recommendations from all the major medical associations and say, hey, let's do this. And that just requires trainings to be available and validated assessment tools to be leveraged. A lot of the stuff that we do is based on a validated assessment tool. And so my suspicion is if we can create a tool similar to that, which it's hard to do that because there's no one size fits all. But if we can kind of get that institutional support, then institutions will kind of push that through. But it doesn't necessarily need to be a single payer system to do that. And then population control, I mean, that's not a realistic solution. I agree with you that as there are increasing numbers of people that we see, energy use go up, but, the timeline that we have and the ethical implications for things like that, I just don't think I don't even know how I would try to answer that question. And then does the health message generically have an effect versus is it related to it being children? I think that it is human nature to want to put others at the expense of yourself. And so I think if I were trying to talk to an adult population, I would, because I'm a pediatrician, so it's pretty easy to get traction with parents. And oftentimes it's pretty easy to gain traction with self-centered, teenagers as well. But, and I don't want to say they're all self-centered, but I'm simply saying like they understand like things are about me when I'm talking to them versus, adults saying like, oh no, you don't need to worry about me. It's like, well, actually we need to worry about everybody. And I think that, there was, who was it? I think Dominique Broussard out of the UW Science Communication section, Ed Maybach and Jonathan Patz, they have data, I think, showing that messaging related to children and the community is more powerful than individualized messaging for the single adult person. So I do think that the context in which you provide that counseling can be important to take into account. And then follow-up questions, I think it's different each time. A lot of times you just got a lot of like, oh, okay, good to know. I will tell you that there were 96 free responses The worst thing that I got in any of the free response sections is fine, but not necessary. That's literally what it was, verbatim, fine, but not necessary. I've never had anyone walk out of my room. As far as I know, I haven't had anybody complain to any like clinic managerial staff, or HR has never called me into their office. Like it's been very low risk for me. I think that the follow-up questions in general sometimes are just related to, well, what are some things I can do? Or wait, why do you think this is affecting my kids, whatever? And then we just have a discussion about what that is. But I would say 19 times out of 20, there aren't any other follow-up questions. It's just like, oh, okay, good to know.
Well, it's hard to cut short the conversation when there's more questions, and I do see John Greenler's question, but I have gone over our time, so I'm going to save your questions after we do our announcements. We will have Andrew will come back for a breakout session with him. But I do want to, we have some important action updates, and I'm going to start with Giving Tuesday. And I guess this is you, Stephanie.
It is. I'm going to start it off. And thanks so much for giving us a few minutes to talk about this tonight. Giving Tuesday is just 2 weeks away, and our staff and board and coordinating council are getting very excited. So we have some really fun plans in the works. This is the 4th year that we're participating in Giving Tuesday, and the 2nd year that we're holding a celebratory event at Garver Feed Mill. And most people have heard of Giving Tuesday by now, but it is an international day of giving that kicks off the charitable season. And it follows Thanksgiving, Black Friday, and Cyber Monday. And this year it lands on November 29th. So our theme this year is Together for the Climate, and it recognizes the power of grassroots climate action. And it is a very important fundraiser for 350 Wisconsin. So we're hoping that you'll think about ways to get involved. Our goal this year is to raise $20,000 by November 29th, which is coming right up. And there are a lot of different ways to get involved, including our celebration, our silent auction, and the opportunity to help us with some peer-to-peer fundraising. And we're going to touch on each of those briefly in the next few minutes. Next slide. So as I said, November 29th is Giving Tuesday, and from 7 to 9 p.m. we'll be having the celebration of our community, our partners, and our volunteers. And we hope you'll join us. It's a free event, but we ask you to register in advance, and we'll be putting some links in the chat tonight. We usually have a program that addresses 350 Wisconsin's year in review and looks to the future, what we're planning for 2023. There'll be some hors d'oeuvres, dessert, a cash bar. We're bringing back the activist cocktail for the 2nd year. We'll have live music, a silent auction, and this year something new. All of our campaign and operational teams are putting together themed baskets, which they're really quite clever. So that will be pretty fun to see. We also do a volunteer recognition. And this year also our art collective is bringing a group art project to the event, which sounds like it's going to be really, really fun. So that's something else to look forward to. If you're not able to attend in person for some reason, we will be doing some Facebook Live broadcasting, but we hope that we'll see all of you there. Next slide. So as part of our campaign, we are doing a silent auction again. So as I mentioned, there'll be some items in person, but the majority of the auction is online. And we have in past years have had over 100 items, and this year is looking like it's going to be just as good. There's lots of different categories. I would say this year we have many more donations from local businesses, which is really, really wonderful to see that 350 Wisconsin is getting so much support from the local business community. And lots more sporting events, theater, and lots of gift cards, as well as some really beautiful art and handmade items from our activist community. So we'll be putting a link in the chat for that as well. The auction actually opens this Saturday, the 19th, and we keep it open all the way through the 30th, so the day after Giving Tuesday. So it gives you lots of time to register, go online, check it out, bid on some items. So definitely check that out. And then the next slide, This just gives you an idea at a glance of all the different businesses and organizations in town that have already contributed, from Old Brick Botanical Gardens to Forward Madison soccer team, Willie Street. We've got some really great events or activities in Milwaukee as well, some Brewers tickets. So I would just say our team has been working really hard to put this action together, and I think you'll really enjoy it. So please check it out. Okay, and I'm going to turn it over to our intern for this semester, Noemi, who's going to talk to you a little bit about being a Giving Tuesday ambassador.
Wonderful. Thank you, Stephanie. So like Stephanie had just said, Giving Tuesday is an international day of celebration, and we are excited to be participating. It's where community organizations and individuals kind of team up to raise money for different causes. And this year, as we did in the past, we are going to be having our Giving Tuesday peer-to-peer fundraiser, which, can I go to the next slide? You can become a Giving Tuesday ambassador just by signing up to or registering for your own fundraising page. And this allows you to have your own specific fundraising platform, and you can connect to your whole community with 350 Wisconsin to support our mission, as well as your friends and family can support something that's also really important to you and important to us as well. So yeah, some tips for getting started. I'll provide with Stephanie just put the registration link in the chat, but you can set your goal. Something that we suggest is maybe 350. It's been like, I guess just a number that has seemed like people have been able to raise. But if you do want to do something lower or more, that is perfectly all right. This is your fundraising page. But yeah, you can also spread the word. You can tell your friends and your family and your colleagues, anybody who you think might be able to donate some and support our mission. And you can also share this on social media, and I'll talk a little bit about that in a second. But you can tag us at 350.Wisconsin on multiple different platforms. Can we go to the next slide? Thank you. This is the registration link, and like I just said, it's also in the chat right now. So you just click the registration link, and then you click kind of the aqua button there to create your own registration. And there's information on that page as well, just a little bit more about Giving Tuesday and just an overview. Next slide. Thank you. So this is kind of what my fundraising page looks like. I haven't been, as you can tell, starting a lot on my fundraising page, but there's a space for you that you can tell your story, and you can add photos, and there's a little bit already at the bottom that kind of describes 350 Wisconsin and gives you a little place to start off. But you can tell your own story and really personalize it so that people know why 350 Wisconsin is important to you, how you've been involved, and what you want to support. Next slide. Thank you. And yes, you can also promote it on your social media. You're able to click kind of the icons in the corner of the page, and that allows you to share it on I believe Facebook, Instagram, and Twitter. And it also allows you can use email, or you can text, or if you just see somebody, you can give them the link as well. It's really easy to just share the link with someone and for them to easily donate however much they want to. Thank you. Here is, again, the link is in the chat, but we are going to be having a kind of help session tomorrow at 6. If you're interested in coming, it is completely optional, of course. It's just if you would like some help with anything as a part of our fundraiser, and I believe the Zoom link just went in the chat. So thank you, Stephanie. And yeah, we will also be having a breakout session later this evening, just if you have any questions. And of course, by all means, you can reach out to me and email me. But yeah, thank you very much.
Thank you, fundraising team. I am looking forward to Giving Tuesday. And so those who are within the Madison area, hope you can join us, people who are within driving distance. Who's going to give our Community Climate Solutions team update?
I am. This is Susan. And folks who normally come to our monthly meeting, we are not doing that this November, giving folks a break for all the work that they did in getting out the vote. I'm delighted to say that our Green Building Group is building a number of digital brochures for Green Building Champions. And we have examples. I don't think that's clickable, but I thought that was going to be clickable. I also want to announce that our Green Building team did a really superb forum on sustainable commercial buildings and residential homes, and that is now available in the as a blog on the 350 Wisconsin website. And I just want to also celebrate the fact that Liz Hockton has just launched an energy equity community working group within Community Climate Solutions team, which is a really exciting and important area for us to be working, particularly now as we're moving statewide. Her group is launched from a report that we did in the City of Madison Community Working Group, and high energy burden for low-income people is definitely a statewide issue. So if you're interested in that particular type of work, it's a research-based and get out the word kind of project, please contact me or Liz Hockton. I don't think her email is right there, but if you contact me, I can connect you immediately with Liz. So I think that's about all I'm going to say right now.
Thank you very much.
Yeah.
We just have two more announcements and then we'll get to the breakouts. Phyllis.
Okay, can you hear me?
Yep.
Yeah, okay. So first of all, just a quick comment about the elections. They were important in so many ways, and we in the tar sands team are especially happy that Tim Michaels, the co-owner of the Michaels Corporation, Enbridge's favorite contractor for laying tar sands pipeline, did not become our governor. And now here is an update about the Bad River Band's lawsuit. In July 2019, the Bad River Band of Lake Superior, Chippewa, sued Enbridge in federal court because Enbridge refused to remove their crude oil pipeline from the reservation, even though some of their 50-year easements had expired. Well, the band didn't get a court hearing until October 10th of this year. And at that hearing, the judge quickly decided that Enbridge was trespassing and would have to pay for that. He declined at that time to shut down the pipeline as he hadn't heard those arguments yet. Then on October 24th, the actual trial started happening, and it lasted 7 days. And it's over now, but the judge has not made his ruling yet. He asked for some more briefs from both parties, and he said he needed to do a lot of thinking. So part of what he'll decide is how much Enbridge will have to pay for 9 years of trespassing, and whether there will be more fines as they continue to trespass. Enbridge arrogantly suggested that the land would cost $4,700 per year to rent, so they should pay 9 times that for the 9 years, or more if need be, but certainly not more than $1 million. And yet in the trial, Enbridge admitted that they make $1 to $2 million per day with Line 5. So that's the trial in a nutshell, and we'll let you know when the judge makes his ruling. And now I have an announcement. And let me see, did I hit that? Let me hit enter down here. And then you'll get what my announcement is about. Some very dedicated people along Line 3 in northern Minnesota are documenting the immense damage that Enbridge has done to their land and water. And they are having a 2-part webinar this Wednesday. And if you attend, you will learn a ton about what Wisconsin faces if we don't stop Line 5. So you'll see it's in 2 segments, but they're both on Wednesday. And then at the bottom also, there's a Facebook event that you can spread the news about that with. It'll be very eye-opening. Thank you so much. I'm done.
And thank you, Phyllis, for that very timely information. Nikki, volunteer coordinator, I think you want to recognize the volunteer of the month.
Yes, indeed. So our volunteer of the month this month is Chuck Schobert. Woo, yay, Chuck. So just a little bit of background here about why he was nominated. He's been with 350 Wisconsin for a very long time. And in 2019, Chuck actually took 2 arrests for the Divest and Defund team, both times while participating in a sit-in at a Chase Bank branch. And prior to each action, he actually was the one who provided nonviolence training to fellow teammates. So after that first action, he actually also recruited a lawyer who provided pro bono representation to those who were arrested for that and the subsequent sit-in, which is really, really great. That representation led to a reduction in fines in both times. So there was a agitator, George Lakey, who visited Madison, who gave a public talk. And that would not have happened without Chuck's initiative. After that event, Chuck actually organized a group to read and discuss George Lakey's book. George Lakey was who came, How We Win. And years later, that book is still inspiring the direction that 350 Wisconsin takes in our activism. So Chuck also made sure that we had a megaphone, which is really helpful for continued actions that we have, and right now is diligently working on the Divest and Defund gift basket for Giving Tuesday. So thank you so much, Chuck, for everything you have done and continue to do for 350 Wisconsin. We are so lucky to have you and your skills and your talents and your time, and we just really appreciate it. So thank you so much for being here and continuing to volunteer with us.
Thank you.
Going to say we should have the volunteer of the month say hello at the beginning so we can see them. But there is Chuck, and yes, that basket that he took into the employees of Chase Bank to try to offer them muffins, you could get that at Giving Tuesday, or a updated version. Next slide. So, as you may, if you're new, you may have figured out we do a lot of things in teams. If you're interested in the tar sands team, the Divest and Defund team, any of these teams, you can contact a team leader, or you can just contact Nikki, because she knows how to put you in touch with people. And in a minute, we're going to have people who are newcomers staying in the main room and meeting and chatting with Nikki. I want to take one moment to see the upcoming meetings. Now, some of these aren't quite right. The climate justice meeting isn't meeting right now. They're meeting tomorrow. The link is in the chat. I also will say Divest and Defund. We're not meeting the Monday after Thanksgiving. We're meeting next week. It's just with Thanksgiving, it's an unusual time. And I do welcome people to that Divest and Defund meeting. Now that it's too cold to go to the farmer's market, we need to be planning for the future. The tar sands team meeting, you just heard about them. Next slide. Oh, and the CAT team was there. The busy community climate solutions team is actually resting this week. If you want to join the art collective, you can contact Russ or Diane. You can contact Stephanie if you want to be helping out more with the Giving Tuesday and the monthly meeting planning. We're actually meeting this Friday. If anyone wants to come to that meeting, just contact me. Next slide. So these meetings, the monthly meeting is open to everyone, and I'm really excited to say that on Monday, December 5th, Kyla Smith, who is 350 Wisconsin's climate justice organizer, who you heard asking some questions, she will be our main speaker about the essential role of community needs assessment in climate activism. My other announcement is don't join us January 2nd. We will be sort of still on holiday. We'll be meeting a week later in January. And then I think we can go back to our normal first Monday of the month. So I think the next slide shows that it's time for breakouts. So if you're a newcomer, just hang, because Nikki would love to chat with you. If you'd like to have